blenderized food. And all right, we're gonna do some once a day. You get this nice package full of extra nutritious food. So that's a green vegetable to help you get enough calories and to help you get enough fruits and vegetables. Okay, so this one is, a lot of times there's green stuff like spinach in it, so it looks green. And you find these in the freezer, and you don't stick it in the microwave because we don't want the plastic problems with the plastic. So when you are ready to give it, or maybe about a half an hour before, you just take a bowl or a pot of warm water and stick the frozen food in there, and it thaws in about 20 or 30 minutes. So we've got our blenderized food, and you need one of the tubes. And we have a couple of them here, but I don't think that either one of them looks really super clean. So I'm going to open a new tube, and these are in the kitchen cabinet. So we're just going to get a new one out, and we'll use that to put the blenderized food in. And you use a large 60 cc syringe. But before we do the blenderized food, before you do any meds or put anything through his feeding tube, we like to vent him. And Sean's going to demonstrate the position that works best for him for venting. So, we have another video that shows the different settings on his joystick. And he has it in the recline setting. One way, could you demonstrate by pointing the button that gets you to the recline setting? Well, we'll just point for him. I think he can see from there. You could be like Vanna White. He's zooming in. Point to this round button here. This is your on-off switch. It's already on. So if you, actually it's easier for the staff person to do. If you push that, it gets it right to the recline position. You don't need to do it's in there now. Whoops. Sean wants to demonstrate all the different capabilities of that switch first. There's one, that's for driving. We've already got that on another video, so right now we just want to demonstrate how you recline your chair. And that's, yeah, we don't want to go too fast. That's a fast speed. So if you don't push the button, you can keep doing what Sean's doing here until you see the picture that says recline and tilt. So he's doing both at the same time right now. That's a tilt and okay, now show recline. Yeah, so recline is just his back goes down. And so what we're going to do is we're going to, and you're checking behind you. That's excellent. There's nothing behind you. So what this does is lay him flatter, and before we do the blenderized food, we're just going to get a chance to get air out. We call that venting. It's like a burp, only it's a burp right from here. So we're going to save our clean tube for the blenderized food, and we're going to use one of these other tubes just to get a chance for air to come out. So we open the Mickey button. We line up the black little mark here with a little black mark here. And if you do that properly, you feel it snap in. I don't know if you heard that, but that's air escaping. That's exactly what we're trying to do. You can hear it, and you can see little bubbles of air that are coming through here. It's continuing to come. So another way to do what I just did, which is actually a smarter way, is to use this clamp that's on this tube right here. If you just press it, it connects, and then it clamps the tube. So when you vent, you never really know what you're going to get out. So just in case you get out not only air, but a little slosh of something in there, you want to have something to catch it in, but you also don't want to just aim it, because it actually can sometimes shoot out at you. So if you clamp it first and then open it, that's kind of a safer way to do that. Are you too tall? Are you too tall? For laying down in the kitchen? No, we have plenty of room. Thank you. What do you mean for the picture of the video? I don't think you're too tall for the video. I think he's got you in it. So now we got that air out, and I'm going to turn the tube the other direction counterclockwise, and I'm going to line up those black marks and pull the tube out. And then I will rinse this tube. I will open it up over here and sink. You don't really need to see all this, but I will rinse it just to kind of clear out some of that stuff that came out. And while we're here, I'll just demonstrate this button. So you can see the whole thing moves freely. So I can actually spin it all the way around in both directions. And it's pretty clean. There's a little bit of stuff on there. So you can always use that. This is an opportunity to just clean that just gently with a moistened paper towel, and it should come up. And that's how you clean this. If you see anything else other than just a tiny bit of little crusty stuff, that would be something that you would want to be concerned about and notify somebody about if you had any questions. So now we're gonna yeah, we can take the note down in the kitchen. So let's demonstrate how we do this, Sean. So we have our blenderized food. I've just got it in here to just hold it, keep it from getting messy. And I'm going to use my syringe. I'm going to stick it in there. Sometimes this gets a little finicky. Alright, so you can see I filled up my syringe and it's kind of messy. So I'm going to rinse this off before I come over here. So once again, this is a Is Stacy what? She goes with the green, mean and green. All right, we'll talk about that in a minute. Okay, this is the. We'll talk about that in a minute. So I'm not understanding what you're saying right now. What does Stacy like? Are you saying
what it tastes like?
Stacy says it tastes. It tastes like whatever's in there. Spinach and orange. Yeah, you can taste it. It's not really meant to go in your mouth. It's not meant to have perfect flavor. It's meant for nutritious value. So it has lentils in it, and it has an orange usually, and spinach, and lots of good olive oil for calories. Sometimes some carrot juice. So I suppose all those things combined wouldn't taste too great. You tasted it before. Blech. Yeah. Well, I can see how you might not want it in your mouth. So, what you always have to do before you put something into Sean is you have to prime it. Priming it means you fill the tube with whatever it is. If it's water or blenderized food, because otherwise, if I just attach the tube now, I'm going to have all this air in there. And I'm going to be putting air in, and we just got done taking air out because too much air in your stomach is upsetting. So you can practice doing this over a sink, but just to demonstrate here, I'm gonna fill this tube, and I don't want to do it and squirt it all over the place. So you might do this over the sink the first few times until you get used to the feel of the syringe. So I filled the tube, then I clamp it. That holds everything in there, okay? Open yep, in fact, we'll have you sit up in a minute because you don't need to lean back anymore, right? So I'm finding the black mark. I'm lining up the black marks. It snaps in. I turn it clockwise. That means it's locked in. So right now I'm checking it with my fingers to make sure it's locked in. I unclamp it. I hold this junction carefully, squeeze in the food. You don't have to do it really fast, but just out like that. Before I remove this tube, I clamp it again, Otherwise, once I take the syringe out, it's gonna fill again with air, or you might lose some out the other end. I'm gonna leave this tube in because I have to give this whole little bag, so I need to refill. This is often what we do, is just cover the tube and then put it up underneath. Sean's gonna sit up because he doesn't need to be laying down to be receiving this food. He can do that in the sitting position. So what I'll do now is fill up again. There's not a lot in here, there's a little over a cup. You don't just want to do this super fast. You don't just want to stand here and do one syringe after another and have the whole thing done in 1 minute. Well, you can do that, but I would think that causes you some discomfort. So I would recommend you not do that. Sean says it's okay, but I'm going to recommend you do it the way I was taught by nurses. So, well, you can disagree, but I'm going to teach it this way, okay?